Hello, family. Welcome back to Life Reconsidered with your girl, Dr. T. Today, we want to continue our conversation about addiction. We want to look at some risk factors that influences addiction and some common substances that can easily be misused, abused, or be addicted to. Now, before we go into that, I want to draw your attention if you are a parent here with a toddler or a middle schooler. Sometimes when we talk about addiction and addictive behaviors, parents do not pay attention to their toddlers. Toddlers, middle schoolers can easily become addicted to their tablets, the computers, and the phone. It's almost as if parents nowadays uses the tablet and phone as a babysitter for their children. The child cries and the mom takes the phone and give it to that child. Now, what tends to happen is that child would watch whatever he or she is watching for so long, and the repetition of that activity can overstimulate the brain. It's the same process of addiction in young adults and adults, because the addictive process uses what? The reward pathway in your brain. Is the same neurotransmitters that are involved in the addiction process, just as in that of young adults or an adult. For young adults, it's easy for them to become addicted to their gaming consoles and computers, laptop, and especially for those who are technologically savvy. You know, they can spend so much time in their room, so much time playing video games, and they can have your brain become overstimulated. Now, when this happens, the brain then crashes, and this can lead to fluctuating moods like irritability, anger. They get easily frustrated. You can see some defensive behaviors in there as well. And it can also lead to reduction or decrease in their activity of daily living, like eating and bathing, connecting with friends. They become isolated. They are always in their room, and you're wondering what is going on there, what are they doing in there by themselves. So it's crucial for parents to understand that easy access to the internet, easy access to phones, tablets, and whatnot can lead to an addictive behavior among toddlers, preschoolers, elementary school students, high schoolers, and even college-going age. So as parents, put structures in place to be able to manage the use of electronics in the house. It's a conversation you all can have. Some families do what we call phone curfews or tablet curfews. Some families have password on the TV or internet, and they are able to set times. So that's a little bit of information to you to keep in mind, and don't assume that the free access to the internet is all good thing and nothing bad. So pay attention to that. Okay, let's delve deep into our goal for today. And like I said, we want to first look at some risk factors that influences the use of substances, especially among young adults. The very first factor that the Center for Disease Control and Prevention talks about is the parent's own substance use. When parents use the substances themselves, the child is exposed to that. And it makes it easy for the child to also to begin to use substances. Another factor, especially among young adults, is boredom. Boredom is a big one. When children and young adults become bored, they spend so much time on the tablet, the laptops, internet, like we said. And when they become so bored, it sometimes induces a feeling of helplessness. They feel like, I'm not doing anything. How can I pass time? And in an attempt to pass time, they become addicted to the internet, and they become addicted by substances that they begin to experiment with. So it's crucial for parents to begin to notice if there's any boredom. For young adults, parents can enroll them or engage them in volunteering activities, especially during the summer. You can volunteer at the library, you can volunteer, at many different places, so that they can actually gain a skill during the summer. If they're too bored and they have too much time on their hands, that can lead to addictive behaviors. Okay, another risk factor is when young adults associate with peers who uses substances. It makes it easy for them to use substances and have access to those substances. So it's crucial for parents, again, to examine the type of friends that your children may have, get to know them, get to know their interests, so that if something is off the tracks, you can easily figure it out. All right. Another risk factor that we want to look at is the easy access to substances. For parents who keep like alcohol bars at home, or have like marijuana, nicotine use, is very important for you to get rid of substances from home. Now, as a child of God, it is important to seal every loophole by which the enemy can use to influence your child and your child's substance use. I don't know if it's good to keep substances at home. That I can tell you is a slippery slope. So pay attention to things like that. If your friends have substances, at home, like alcohol bars, stuff like that, those are things that you want to check and seal those loopholes, so that your child doesn't get exposed to easy access to substances. Another risk factor among young adults is the lack of connectedness to school or low academic performances. Research shows that children who lack connectedness to school and connectedness to family, connectedness to their friends, and have low academic performances have the tendency to begin to use substances. And the reason is that when there's low academic performances, the child begins to feel a sense of helplessness, a sense of pepperlessness, like I don't have peppers, I'm useless, I'm good for nothing, there's nothing I can do right. So those strong negative emotions, begin to loom around that child. And in an attempt to numb those negative emotions, the child tends to using substances. So again, very crucial for parents to help monitor and help the children or your child have a sense of connectedness to school and some level of academic achievement. All right, let's now move to some classes of substances that can be produced. Now, the first one that we want to talk about is inhalant. Inhalant comprises of gas, glue, and aerosol. Now, one example of those gases can be laughing gas. Yes, laughing gas. People can get easily addicted to laughing gas. And glue. I'm not sure if you have seen a video of kids on the street sniffing glue. Glue can be very addictive. And the aerosol cans, very addictive as well. Now, in terms of inhalants, people who use them, you will hear like terminologies like huffing. When you hear somebody says, I'm huffing, it means that they are using inhalants and the classes of inhalants that we just mentioned. Another class of substances are the depressants. And the depressants can also contain like your regular prescription medications. Your depressants comprises of the class of benzodiazepines and barbiturates. Some example of those medications can be Ativan, Valium, Librium, Xanax, or phenobarbital. So if you go to your doctor and your doctor prescribes some of these medications, understand that there is a tendency to misuse, abuse, and be addicted to them. So stick to your prescription and make sure that you are helping yourself and not opening the door to any addictive behaviors. Okay, another class of medications that we want to look at opiates. Opiates includes medications like oxycodone, Vicodins, codeines, the strong substances like fentanyl, morphine, heroin, and I want to throw one more in there, the synthetic opiates like tramadol. So again, very crucial, if your doctor prescribes any of these medications for pain management, know that there's a tendency to abuse those medications. And another category of substance we want to look at is stimulants. Your stimulant contains your uppers, which is amphetamines. And caffeine can be an upper. Caffeine can be considered a stimulant. Some of our favorite energy drinks contain, caffeine. And this can actually lead to addiction if we keep drinking those energy drinks over and over and over again, like we discussed in last week's video. Very important that you are mindful to how much energy drinks you are taking a day and even how often you are drinking them. Now, amphetamines can also be medications that are prescribed to treat ADHD. Now, if a child is on prescription medication for ADHD, it's crucial for parents to manage those medication and make sure that the child is not abusing them. In addition to that, if as a parent you are on any amphetamine medication, even for your own treatment, or if you are taking any opiates or some of these depressant medications that we talked about, make sure that you secure your medications at home. Because when children have easy access to the medication cabinet, there is a tendency for them to experiment with that. And when their mood is altered, it opens the door for addictive behaviors and for them to be addicted to, those medications. So please make sure you secure your medications at home as parents. Keep your medication cabinet secured and locked away from your children, including your young adults. All right, another class of medication or substances that we want to look at is the hallucinogens. And for some of you, maybe you have had psychedelic drugs. The psychedelic drugs consist of the LSD, the mescaline, the ecstasy, the ketamine. Ketamine contains hallucinogen properties. And the common one in this category is the magic mushrooms. Some states are beginning to approve microdosing of mushrooms for the treatment of depression. So it might seem like it's okay, but if you use magic mushrooms in excess, you can be very addicted to this. And hallucinogens is noted to alter people's reality instantly, and it can lead to psychosis tendencies. So let's pay attention to that. All right. So let's look at some common substances that is abused among young adults. And the first one is marijuana. Marijuana now comes in different forms and potency. And the most potent one, I believe, is the concentrates. And you might hear words like wax or dabs. It also comes in bubble hash. It comes in the edibles, and some of the edibles are made to look like gummy bear. So you might think it's your regular gummy bear. It's important for parents to be vigilant and pay attention to the different forms of marijuana that is on the market right now. It's easy to have access to them. So parents, please pay attention to the various forms of marijuana. Some of the edibles can be used even in baking, muffins, cakes, cookies, whatnot. So again, be vigilant. Another common substances that young adults can become addicted to is vaping juice. Now, with the vaping and vaping juice, some of the juice have little to no odor or smell. So if parents are banging on, smelling it on the child or in their room, you may miss out on that. The juice are flavored. So some of young adults think that because it's flavored, it's okay. For young adults who have used a lot of these juices and vape a lot of these nicotine products, they've developed what we call like popcorn lungs. You can look it up and read more about it. So the fact that it's juice and it's flavored doesn't mean that it is okay to use. Your young adult can become very addicted to that. Now, I must say that the market has become so crafty to the point that they have manufactured vape hoodies. You know, the sweater with a hoodie? Yes, they have manufactured that. And there is a hideout for vape pens inside of the hoodie. And some of the hoodies, the hideout is right on the laces. You will see it right on the laces. The vaping pen is hidden in the lace. So you might think it's a regular design, you know, to look like it's something fancy, but that can be a vaping pen right inside of the hoodie. So again, parents, be vigilant. Another common substance that is misused among young adults is alcohol. It's easy for people to get alcohol now. It's easy for young adults to get alcohol now. Some people can even order alcohol, you know, from their favorite bars, and it's delivered right at home. I had one instance when the parents saw a delivery person delivering alcohol over their fence to their young adult. Yes, over the fence to their young adult. So parents, please pay attention again and be vigilant about some of these substances that can be misused or abused. Other substances are bath salts. Ketamine is now on the rise, and the various forms of pills, Molly, you know, those or ecstasies, or you know, the depressant Ativan. a child can go and easily get hints of Ativan um, or Valium and stuff like that. So please pay attention. Okay. Now, as a parent, what can you do to mitigate some of these risk factors? Now, one easy thing that as a parent you can do is to be engaged in the life of your child. When I say that, I'm not saying you should be a helicopter parent. I'm saying that be involved in the life of your child. Get to know your child, get to know their friends, so that when something is going off track, you can easily figure it out. You can also involve other family members in supporting and helping your child in the various ways that you may not be able to. Connect your children to safe people, safe places, like we talked about earlier, volunteering activities, church activities, youth groups, and stuff like that. And make sure that you don't just send them without monitoring. Send them to this camp meeting, send them to these groups, but also monitor and make sure that if something is off, you'll be able to figure it out immediately. Another thing that you can do as a parent to mitigate some of these risk factors is to help your child develop a sense of connectedness to school, and also put structures in place to help with your child's academic success. Like we said, when children have, low academic success, they tend to have negative feelings and they internalize that. And in attempt, we try to numb those negative feelings. So put structures in place so that your child would easily succeed in their academics. Connect them to healthy relationships so that they are not isolated. And above all, make sure you don't cease to pray for your child, because there's nothing, absolutely nothing that prayer cannot do. So help them. Make sure you have good support system around them, including their friends. Okay, if you have questions about today's topic, don't hesitate. You can email me at mylifereconsidered@gmail.com. Again, mylifereconsidered@gmail.com. Thank you so much for joining me again in today's discussion. And I hope that you are an informed parent or an informed adult. It is my hope that you use this information to help you, yourself, and that young adult of yours, so that you make informed, wise decisions. Again, thank you for joining me in today's discussion. See you again next week or sometime soon. All right. Thank you.